If you've had a myomectomy or the removal of fibroids, you might be wondering, how fast do fibroids grow back after a myomectomy? Join me today for this episode while we talk about this and dive into fibroids and so much more in our conversation. I'm Dr. Perkins, a board-certified OBGYN, and I'd love for you to join us for our conversation today. Come on in. In today's session, we'll talk about what causes fibroids to grow. We'll talk about risk factors that leads to fibroids growing, and we'll talk about how fast do fibroids grow with or without removal. Let's start by talking about what are fibroids. Fibroids medically are called myomas or leiomyoma. Fibroids are a compilation of smooth muscle fibers as well as fibrous tissue. These are all medical terms representing things that are within our bodies naturally, not inside of the uterus in this form. However, they come together and form together as a ball. That ball together of cells is actually kind of hard. They're very firm tissue. But over time, they can grow bigger and bigger and bigger, changing from the size of a grain of rice to as big as a small watermelon. They can get pretty large. For many years, we've been trying to figure out, well, what causes this to happen? We're still not sure about this. What we do know is that a majority of females will have fibroids, and really up to 80% will have them before the age of 70 years old. People may have fibroids and do not know that they're there. Some may have fibroids and have symptoms, so they're aware they're there. And some may find out incidentally because they're getting imaging tests for some other reason, especially in the emergency room. Fibroids range in size, but they may also range in location. Let's talk more about that. Fibroids may be in the inside layer of the uterus. They may be in the muscular layer of the uterus. They may be on the outside layer of the uterus, and they may also hang off of the uterus. These fibroids may grow and grow and grow over time because the fibroids are being fed with things that the other organs in our bodies are fed, such as blood. They love blood. They love the nutrients that comes in blood. They love the oxygen that is within blood. They also love the hormones that come to them through the blood, which is primarily all of them. As we continue in the research world to study where fibroids come from and how they are influenced, we know that there are several risk factors to having fibroids. The first, and probably one of the most important if you ask me, is having a family history of fibroids. In fact, if your mother or older sister has had fibroids, the likelihood of you having fibroids is also really high. And this is because there is a genetic component to having fibroids. But essentially, we've also mentioned that fibroids are very common in the reproductive years. So just being female is probably one of the greatest factors to having fibroids as well. Obesity has been linked with having fibroids. The reason behind this, we suspect, is that in an obese state, there are additional fat cells. Fat cells secrete additional hormones. And in reproductive terms, this type of hormone is an estrogen, and estrogens tend to feed fibroids and allow them to grow more and more. So in an obese state, if you're producing more hormones, the likelihood of having fibroids increases as well. Diets high in red meat has also been linked with having fibroids. And the theory behind this is that red meat and the fat cells surrounding red meat coming from animals may be filled with antibiotics and steroids, growth hormones, different things that when you ingest them as a female, increasing the likelihood that hormonal conditions such as fibroids may increase. People with high blood pressure have also been linked with having a higher risk of having fibroids. Theoretically, if you have high blood pressure, more blood pumping through at greater pressures, this may be increasing the amount of blood flow that is going to your uterus and your pelvis and the pressures within, incorporating the fibroid tissue and allowing it to grow more and to enhance its growth. Lastly, being a Black female has been shown as a risk factor for getting fibroids. In fact, research has shown that fibroids are more common in Black and Caribbean women, as well as the amount of fibroids are higher, the size of fibroids are larger, and fibroids tend to present in their system much earlier than in the rest of the population. We have more to cover on this topic, but while you're listening, if you're enjoying our conversation, go ahead and click subscribe, join our channel so that you will know exactly when new videos are added here. Now, let's talk about some of the symptoms with fibroids. In general, most people with fibroids do not have any symptoms. For those who do, they may notice that their periods have been heavier, they last longer. You may have bleeding in between your cycles, which is very new for you. You may also have abdominal pain when your cycles are on. These are not present with everyone with fibroids. In fact, so many people have fibroids and do not know. For those who do have symptoms, this may be a reason for you to get treatment. Treatment may be in the form of shrinking the fibroids or removing the fibroids. As we're talking about in this episode, our focus is on a myomectomy, which is a surgical procedure to physically remove fibroids from the body of the uterus. With that, the uterus remains inside. This is not a hysterectomy. Only the fibroids are being removed. Once the fibroids are removed surgically, this can be done with an incision that is very similar to getting a C-section, or it can be done laparoscopically or robotically with very tiny incisions. In this procedure, most surgeons will try to remove as many visible and large fibroids as possible. It is important to note here that removing the visible fibroids, or the largest ones, does not necessarily remove all the fibroids that are present inside of your uterus. This is because fibroids range from the size of a rice grain. If you can imagine trying to remove a fibroid the size of a rice grain from your uterus will probably be very tedious and may cause a lot of scarring, cut, and bleeding in your uterus, and this becomes more dangerous for you. The goal is to remove the problematic fibroids, the large fibroids, so that may leave some fibroids behind. Now, the question here today is, how fast do they grow back after a myomectomy? The fibroids won't grow back. What happens is that the seeds, or those rice grains of fibroids that were left behind, continue to grow to the point that you can start to visually see them on ultrasounds, for instance, or you start to have symptoms because they've gotten big enough to cause a bleeding issue. In general, fibroids grow at a rate of 1 to 2 centimeters per year. This is normal. In 5 years, a small, tiny fibroid after a myomectomy that was left behind may get to be the size of an orange. It takes 5 years to get there. Now, on a side note, I do want to mention that not all fibroids are non-cancerous. About 2% of fibroids may be cancerous. The cancerous form of fibroids may grow faster than the normal would. So instead of 1 to 2 centimeters in 1 year, this may happen in a few months. This is why it is very important that you stay in tune and communicate with your doctors. Check on these fibroids as recommended so that your doctors know what's happening, the rate that they're growing, and so that you're aware and know whether or not these fibroids need to be removed, and in other instances, not be removed. I'd also like to put a pin here to note that in pregnancy, fibroids may grow faster and not be due to cancerous fibroids. I'm excited to offer you today a free copy of my ebook, Hormones Don't Lie. To get that, click the link below and you'll get more information about how to get this ebook. Thank you for being here. It's been a pleasure. See you next time.